Today, we're going to talk about something that affects millions of people, and that's arthritis. Unlike, I think, how people think about arthritis, it isn't just one thing. There are over 100 different types of arthritis, and conventional medicine has an answer for all of them that seems to be quite limited. It's steroids and or monoclonal antibodies, which modulate the immune system to decrease the inflammation and help give relief, but it just glosses over the symptoms. It suppresses the symptoms. And today I'm going to be talking with Dr. Micah Yu, who is not just a rheumatologist, but is quadruple board certified. This guy never stops learning, I don't think. And am I getting to know him in my conversations? He is a wealth of information. He has got so much energy, and I'm excited to talk to him about this integrative approach that he takes and how it can help patients finally get relief naturally and understand how this works compared to the conventional approaches. So, Dr. Yu, welcome to the Delivering Health podcast.
Thank you so much for having me.
So, your bio is so impressive, quadruple board certified. You couldn't just stop at one or two like most people. Why are you so passionate about continuing to learn in this area that goes against the grain? This is not anything you learned in medical school.
Yeah, it all started with my own journey. I'm a patient myself with a rheumatic condition. I have an autoimmune arthritis called spondyloarthritis. And I don't want to spend half an hour talking about my own story, but pretty much to sum it up, I heal myself naturally. I went on an anti-inflammatory diet. At that time, this was around 6 years ago. No, 7 years ago. Now it's 2025. Now, 7 years ago, I went on a whole food plant-based diet. Within 2 months, I was pain-free. My labs went negative, and that got me thinking, what else is out there that I'm missing that can help patients? So for me, it's been a nonstop learning because I'm a patient myself, and every rabbit hole I go down on, I discover more rabbit holes into why patients have an autoimmune condition and what else I can provide for them to heal.
So I was talking in the introduction about arthritis, and you're talking about autoimmune conditions. Are arthritides, plural is my understanding, that's how you pronounce it. Are they all autoimmune conditions?
Great question. That's one I get all the time. Not all arthritis is an autoimmune condition. For example, you have osteoarthritis, which is more of a wear and tear arthritis. That does have inflammation locally, but there is some gut changes as well, but it's not an autoimmune condition. Gout is another type of arthritis that's not an autoimmune condition. It's a crystal arthritis that's being influenced by uric acid as well. So those are two examples that are not autoimmune related. So not all autoimmune conditions are rheumatology conditions, and not all rheumatology conditions are autoimmune in nature as well.
And is your approach then just focused on autoimmune arthritis conditions, or across the board, any type of arthritis that somebody might walk into?
Yeah,
Anything?
well, on the internet, I promote myself more autoimmune. But in my clinic, I do everything rheumatology related, a lot of integrative things as well. I deal with IBS, SIBO, mold, Lyme. I do everything else beyond just rheumatology in my clinic.
So let's talk about the autoimmune component. The monoclonal antibodies, the steroids, those are the mainstays, as I understand it. Correct me if I'm wrong, of conventional rheumatology. The integrative stuff that you're talking about, the anti-inflammatory diet that you mentioned, that you'll get more into. Just what did you learn in your medical? First of all, where'd you go to medical school? And in that training, in the board certification process, how much did you learn about diet and lifestyle intervention and these integrative approach that you're doing now?
Yeah, great question. So I went to medical school in Chicago. It's called Chicago Medical School, and I went to residency in Loma Linda University, and that's where I did my rheumatology fellowship as well. And in in my training, we never learned um much about supplements, anti-inflammatory diets. Actually, we didn't learn anything about anti-inflammatory diets at all. I got all that knowledge through my own extra education, personal education, but I also learned that through the Andrew Weil Integrative Medicine Fellowship and through functional medicine as well. So I combined all these different educational pathways together to come up with my own formula for my own patients. So no, the approach that I have to my patients now is totally different than the approach that I was trained to do.
And it's it's fascinating to hear this because it's something that I've known forever, and I keep hoping that it's going to change. Doctors who are going through medical school now, I'll ask them, what they're learning, and it still seems to be these integrative medicine approaches are not integrated into the conventional medical school curricula, despite the fact that there are decades of research in the medical literature supporting it for so many different conditions. When you're at Loma Linda University, that area is a blue zone. It's known for its longevity. It's known for the effects that diet and lifestyle have on health. It's been studied in that area. I'm even surprised that there, while you were living there, while you were doing your work there, that wasn't something then that was taught, because that is the heart of the blue zone in the United States.
Correct. So yeah, it is a blue zone. It's one of the places that live longest in the world. But at Loma University, the all the departments are very siloed. So I was an internal medicine resident. So pretty much I got exposure to internal medicine. I didn't get exposure to lifestyle medicine. That was another department out there. So we really didn't get training. I think I could have wanted, if I wanted to do a rotation through lifestyle medicine, that was an option. But that's still not integrated medicine at its full capacity. That's just a snippet of it. And it's more about eating more vegetables, eating a more whole food plant-based diet. But you and I know that anti-inflammatory diets and integrated medicine go beyond just talking about simple lifestyle shift. It's much more, it's deeper than that. It's about supplements. It's about looking at root causes, and things that you've learned in your training in the past.
So it's interesting. Integrative medicine, for people who don't know out there is no official definition. A doctor can put a massage therapist in their practice and say they practice integrative medicine. So how do you define it? What's your working definition of integrative medicine?
Yeah, you're absolutely correct. So anyone could put up a shingle at the door and say, "I'm an integrated medicine practitioner with no training in any type of integrated medicine." They could go to a weekend course on nutrition and call themselves that. So to me, integrated medicine is really not only talking about lifestyle changes, like talking about diets, talking about sleep, exercise, stress reduction, mind-body medicine, but it's also about supplements, herbs, environmental medicine, environmental toxins, how to do detoxification, what are the root causes, what's the role of mold, what's the role of Lyme. I mean, you can go through these different training programs, even University of Arizona. You don't talk about mold, you don't talk about Lyme disease in particular, you don't go take a deep dive. So all the even functional medicine training, you don't talk about mold and Lyme in the deeper understanding. It's very superficial if they mention it at all. So for me, I've integrated all these different training programs. I've had to learn from different gurus out there that specialize in mold and Lyme just to understand it and incorporate into my own practice of medicine.
So what is the connection with those diseases and autoimmune diseases? And by the way, I mean, autoimmune diseases go much, are much larger as a category than just those that affect the joints. And
Correct.
we're sort of focusing on that. But just briefly, is there any difference in what the approach would be for an autoimmune disease that affects the musculoskeletal system versus a different type of autoimmune disease like Sjogren's disease or
Right.
lupus or something like that?
Right. Yeah. Great question. So, don't get me wrong. I still use medications in my office, and I incorporate into the whole paradigm of treatments that I have. So, the treatments from the Western medicine side, yes, there's a difference whether you have Hashimoto's hypothyroidism versus you have Sjogren's. But if you're talking about from an integrated perspective, lifestyle changes are pretty much generalized to the whole autoimmune conditions out there. So, that if you go on an anti-inflammatory diet, that isn't really different from whether you have rheumatoid arthritis versus Hashimoto's hypothyroidism. Now, when it comes to anti-inflammatory diets, it's very individualized. Some patients will have food sensitivities, um, and it doesn't really matter what kind of condition you have. It's just based on your gut microbiome and your genetics that produce that food sensitivity. So it's not really disease related what kind of food sensitivity you have. And environmental toxins, the approach to that is still very generalized to the autoimmune condition in general. Whether you have a rheumatology problem with rheumatoid arthritis, whether you have lupus or Hashimoto's, I'm still going to attack your environmental toxins and try to do detoxification either way. And when I think about mold, mold can affect all these conditions as well. Lyme is a little bit different. Lyme disease, I'm looking for more brain fog, memory issues, joint issues. I don't, did I mention fatigue as well? Maybe
Mhm.
rashes. Hashimoto's, I don't think of Lyme so much. I think of other musculoskeletal issues, and other conditions. Sometimes Hashimoto's, yeah, could it relate to Lyme? Possibly, but that's not the first thing I think about. So there are a lot of things in integrative medicine that we use to approach autoimmune disease in general very similarly. But there are things like when we talk about Lyme disease or even supplements themselves, supplements are very tailored towards specific diseases. So supplements I use for Hashimoto's are not going to be the same supplements I use for rheumatoid arthritis. Some of them will cross over, but some of them will be different.
So it's interesting because as you're talking, I started thinking how incredibly dependent the quality of care is on the individual doctor and like who's somebody seeing, because the presentation, the different symptoms you mentioned, brain fog versus other symptoms, maybe more either they point you in a certain direction in terms of possible testing, because I mean, people can spend literally, five figures worth of testing, thousands and thousands of dollars of testing. And at some point, hopefully initially there has to be some judgment by the clinician of based on what they're seeing, what the conversation is, and what the symptoms are about what to, the hierarchy, what to test first, second, and third. And so that's what makes a lot of this, I think, so challenging, because in conventional medicine, it's typically very protocol driven. You have X, we do Y. We test for Y. We prescribe Z. It's very much algorithm based, and integrative medicine at its core, when it's being practiced the best way, it's not that. It's really, teaching doctors and doctors learning how to think from a systems perspective about the whole body and how the different systems and hormones, interact, and how different symptoms present. Because again, understanding what tests to order, it's not a one size fits all. It's very much personalized. But what I'm hearing, once you get to that diagnosis, the approach is generally similar, with respect to some fundamental changes that you see the best results with. And one of those you mentioned is diet. So what does an anti-inflammatory diet look like in general?
Yeah, anti-inflammatory diet, if there it comprises of different diets out there. You can do a Mediterranean diet, that's an anti-inflammatory diet. So that's a lot of vegetables, whole grains, some meat in there and some fish. There's also a paleo diet. Paleo diet can be anti-inflammatory. A keto diet in some instances can be anti-inflammatory diet as well. And also a whole food plant-based or vegan diet can be anti-inflammatory diet. What do all these diets have in common? They all cut out ultra processed food. They cut out your refined sugar, your sodas, your candy, your pastries, and they cut out food that is not necessary to eat, to live. And a lot of these foods will focus on whole foods. So a vegan diet will focus on whole food, well, unprocessed vegan diet, like a whole food plant-based diet, will focus on whole food, vegan or vegetables or whole grains, beans. These are all anti-inflammatory. A paleo diet also focuses on unprocessed food. It focuses on meats. It focuses on vegetables and fruits. And a keto diet focuses on unprocessed meats out there. Now, can every single patient that goes on any of these diets heal their body? It's not guaranteed. It's helpful, but sometimes a patient's condition is beyond diet. They need a lot of supplements. They need to go detoxification. They need to look at other root causes to heal. But in general, what I tell most patients is start with a Mediterranean diet first. If you're new to this, and then maybe you can tailor it and try other diets later on to help with the condition.
How do you help people recognize what an ultra processed food is?
Yeah, I'd say stay away from the middle aisles of the grocery store. Read your labels.
Yeah.
Eat the way that we were intended to do when God created us. So try to eat your vegetables in its original color and form. try to eat if you eat meat, try to eat meat that's unprocessed, grass cut, grass fed, and fish wild caught. And if you eat whole grains are also anti-inflammatory. I know that a lot of patients have issues with grains, especially gluten, but in general, whole grains are anti-inflammatory, like quinoa, millets. Try to eat those and try to eat it in its original form for all these foods, even beans itself.
That's
If you
it's interesting. 70% of I did a CE talk recently on ultra processed foods, and 70% of packaged foods in the United States are ultra processed foods, and 60%, 57%, so almost 60% of calories in the American diet now is from ultra processed foods. So those changes that you're talking about, to me, they are so fundamental for long-term health and restoring health. But as you said, it's more complicated than that. It's not just for a lot of people you change your diet and everything's better. So how do you determine then what nutrients somebody might need additionally as dietary supplements?
Great question. So I do get labs on my patient. I get micronutrient labs. I get vitamin labs as well. And I start from there. Those are the cheapest labs you can get any lab in the United States. But in general, patients, I tell them it's not wrong to go on a multivitamin. It's very low risk to go on that. So that's number one. And depending on what mineral or vitamin deficiency, I will add that on as well. So there are different other supplements I put on patients: omega-3 fatty acids, pro-resolving mediators, boswellia, turmeric, probiotics, prebiotics, and I will NAC glutathione. I'll add these on depending on the situation, and I will get other integrative tests to help me determine what other things are causing my patient's issues. Is it a parasite? Is it candida overgrowth? Or some of the other things I mentioned already? Is there mold? Did they have mycotoxin illness or mold toxicity or exposure that might be contributing to their inflammation?
I love your approach with the testing because I got very frustrated when I was in clinical practice when before I started doing more functional and nutritional testing. I'd be sitting there with a patient with, I thought, brilliant, well supported recommendations, and giving them those my treatment plan for them. And it was really me just saying, believe me, believe what I'm saying. Once I started doing testing, the recommendations were able to get even more specific, but people's motivation and compliance went way up, and their results went way up, that they were getting faster. And a lot of people, they've come to me over the years, and I'm sure you've seen this, with literally bags full of dietary supplements that have been prescribed to them. And to me, that's the analogy of analogous to cooking without a recipe. Let's just try a little bit of this and a little dash of that and see what works. And when you do the testing, it takes the guesswork out of it, and it allows for that very precise, customized, personalized approach to treatment plans that then can be monitored better and adjusted over time. And
Correct.
you mentioned the microbiome several times in this, or the gut health specifically. What role are you seeing that play?
Yeah, great question. So I know a lot of patients with autoimmune conditions already have gut dysbiosis or leaky gut. I usually don't need to test them for that when they come to me with all these different symptoms. But what helps me when I get a gut microbiome test is um, what bacteria is causing the dysbiosis, and also is there candida overgrowth? Sometimes they'll tell me that, or is there a parasite in there that is causing their autoimmune issues? Sometimes that's what a gut microbiome test helps me with. And I want to go back to the conversation that we had about supplements. Sometimes when patients are on 30 supplements, 40 supplements, I've seen this before. I'm like, how is this any different than a Western allopathic trained doctor
Yeah.
giving a patient 10 to 20 medications? Because yeah, supplements might be lower risk, but we've seen case reports and patients going to the ER or even the ICU sometimes because of severe liver damage from supplements. It happens. And we're just throwing supplements at patients. Patients are on 20, 30 things. It's sort of similar to medications where you're keeping patients on forever or for a very long time, these supplements with no end game. So for me, the way I approach it is I put on a couple of supplements at a time and see whether it's helping them. And I do labs such as a gut microbiome to see what else I need to add on and tailor their medication or supplement approach.
I love that because that was exactly my experience and frustration, and not just the number of supplements, but as you mentioned, some of these doctors are putting patients on these dietary supplements indefinitely. And for me, where I kind of have landed on all of these issues is that dietary supplements should be used as the FDA intended. That is, as a supplement to a healthy diet. And so when with the testing like you're doing, you identify nutritional deficiencies and you can replenish them. And then I imagine at a certain point, those nutrient levels go up that somebody may not need to be taking that nutrient forever. And then you have other more, what I categorize as more, functional nutritional interventions, like you mentioned, boswellia, turmeric, some of these nutrients that are anti-inflammatory that somebody may be on longer term because it's not replenishing a deficiency, it's modulating the immune system and helping to restore that balance. Do you find the same thing?
Yeah. Oh, sorry, John, can you repeat that one more time?
The that somebody's gonna, which part?
Oh, that's the last couple of sentences.
Yeah, let me just mark the time here. That hold on a sec. That way I'll see a spike um in the wavelength on the recording. I'll know where to go to tell them where to edit out. So the that some of these nutrients people will be on longer term that are more modulating the immune system than replenishing deficiencies like turmeric or boswellia that are anti-inflammatory. Do you find that people are may end up taking those longer term versus they have a deficiency in vitamin B12, so you give them B12 until their blood levels normalize or they're back to a healthy level and then they can stop it?
Yeah, correct. So that's what I do with my patients, and that's what I see as well. Some of these mineral deficiencies or vitamin deficiencies, patients take it more short term, maybe a couple months to a year, and then they stop it. And then some of the other ones that you talked about immunomodulating, like boswellia, turmeric, Chinese skullcap, I use that longer term. And once the patient gets better, sometimes you just need it's a extra kick for them on top of the diet. Sometimes if they go pain free or the autoimmune condition gets better or resolves, actually scale back some of those supplements and try to use food as medicine and lifestyle change to be the core treatment plan, and then use those supplements as needed.
Are there supplements that work off the same molecular mechanisms as the FDA approved medications like the monoclonal antibodies?
Yeah, definitely. Like turmeric, there's over 6,000 studies out there. We know that it decreases tumor necrosis factor, interleukin 6, interleukin 1. These are inflammatory cytokines. And for those of you that don't know what a cytokine is, it's a cell-to-cell immune signal in the body, and it could be anti-inflammatory or pro-inflammatory. And in rheumatology, we have medications that decrease TNF, they're called biologics, tumor necrosis factor, interleukin 1, interleukin 6. Turmeric does lower these inflammatory cytokines as well. However, of course, they're not going to be as strong as the medications, but it does come with less side effect profile. If you go on an anti-inflammatory diet, it will lower these levels as well. So you can do a lot of things to lower some of the same pathways that medications are lowering for inflammation. It's just a matter of, is it going to work, and how much is it going to lower the inflammation, if at all?
So do you find in terms of stratifying patients about what you think approach is going to work versus not work, and you may still need some additional medications on? Is it just based on the severity of the presentation or how long they've had it? What would somebody expect? I mean, is it reasonable for somebody who's had an autoimmune arthritis condition for 20 years that they would get benefit without the medications?
Correct. So it's every patient is different in my clinic. Everyone has a customized plan. What makes it fun, unique, but challenging is that I combine integrative care, naturopathic care with rheumatology and Western medicine. And it really depends on the patient. So if a patient's coming to me with their hands twisted, fingers twisted from long-term rheumatoid arthritis, they have holes in their bones already, it's going to be more of an urgent case where I will throw on medications on them and at the same time integrate lifestyle changes. If a patient that's coming to me more mild, they just started the rheumatoid arthritis maybe 6 months ago or a year ago, and they tell me, listen, I have pain maybe 3 times a week, or my pain's about 3 out of 10 right now on a daily basis. I tell them, we have time to try to use natural ways to get better first, if that's what you want. And then from there, we can maybe add medications if you're not getting better. And then in hopes of weaning off the medications later on. At the same time, we will do testing in integrative advanced testing to see what else could be driving your issue. So everybody's has a different formula in my clinic.
And with your condition that you started out this interview, talking to us about how you got into this, I'm assuming you've did obviously the diet. I mean, that sounds like that's really the foundation. And people go to your website, which everybody should. You have some amazing resources on there and information. But diet is obviously the foundation for long-term health. Nobody disagrees with that in any field of medicine or research. But you've taken it to another level in rheumatology in terms of your diet prescriptions and helping people transition. And you've actually created resources like cookbooks, and you're creating an online. Will you tell them about that? Tell them about the platform you're telling me that's starting tomorrow. You said.
Yeah, yeah. So I have a 21-day autoimmune reset program that's gonna help walk clients. I'm a coach in there. I'm not the patient's doctor. So I would say my clients through that program on the foundational pieces that they need to employ in their own life to help with their autoimmune program that their doctors are not talking to them about in the clinic. So this is a foundational piece. This program could potentially heal patients as well. I'm not going to guarantee that, but I have used diet. I have not taken any medications to heal my own arthritis. It was purely diet and lifestyle changes. So I'm going to use the same information that I give to my own patients in my clinic and put them into the program that's 21 days long for patients in there so they can learn on their own. Because a lot of patients, they want to see me in my clinic. They either can't get access to me, they're outside of the United States, or they can't pay the fees in my clinic. So this is a very affordable program that patients can use and clients can use to help with their condition.
Well, and one of the challenging things out there, because this is integrated medicine that is not taught conventionally, that's not integrated into our conventional medical system, people have to become their own detectives essentially and find those professionals who have done the work, who understand this, and seek them out. They're not going to be referred to them by their insurance companies. And one of the things that I admire about you that you've done in your passion to help improve people's lives is that you've taken this information and you're making it accessible to anyone anywhere in the world to help them. And I'm sure through that learning process and the 21-day program, they'll also have better educated conversations with their doctors about what they're doing and how it's helping them. And hopefully through that, maybe other doctors will become more interested as well, because we need the needle to move in medicine in exactly the direction that you are passionate about and advocating for. So thank you. I mean, thank you for your work. I knew when I met you, you were special. When I met you at the conference, I'm like, this guy, he's special, and people really should take advantage of your brain, your knowledge, your passion, and compassion. How do people how can they reach you and find out more about you and your resources?
Yeah, if you want to see me in my clinic, I see patients through telemedicine and in person. I'm in Southern California, but I'm licensed in a lot of states in the US. You can go to drlifestyle.org. That's drlifestyle.org. If you want to find me on social media, my handle is my autoimmune MD. And I'm on YouTube, Instagram, Facebook, TikTok. And also you can go to my website, myautoimmunemd.com, if you want to learn more about my coaching program and get more resources to learn more about your autoimmune condition.
Phenomenal. And those are all going to be linked in the show notes. Thank you so much for spending some time. Appreciate it.
Thank you so much, Dr. Newstat.